One comment I'll make on the appeals process, because there were some IFRs just recently issued on that, and it may be, depending on the state, there are a number of states through their own insurance departments that have regulations relative to appeals that may satisfy, at least for the fully insured employers, that external process. Your internal is your insurance company appeal process that's already stated. It's in your communications, hopefully, what that process is. The external, the state of Kansas, for example, through the Kansas Insurance Department, does have an appeal process already in place that should an insured have appealed their claim through their health insurance plan, and that claim is still adversely impacted by that decision, they can take it to the Kansas Insurance Department. There is an independent arbitrator process that's in place which may satisfy the requirement under the new health care reform legislation for appeals. Now, the language within your policies will have to be beefed up to be in compliance. But historically, most state regulators have not taken authority over self-funded plans. So whether that could be broadened to be that external process for self-funded plans, I think is a question that each state's insurance department will have to answer as to whether they're going to be willing to take on that process for self-funded plans to help with the external view for a self-funded plan. So with that, Clinton's going to spend some time talking about the subsidy provision, which is available to smaller employers.
We have about, our intent today was to spend about 90 minutes going through the content and then reserve about 20 or 30 minutes for questions at the end. So we're going to move through these next few years probably rapidly. But for our small employers in the room, well, small employers anywhere, but in the room right now, there is a tax credit that does apply for the small employers. You're only fully eligible for the tax credit if you have a combination of two things. One is 10 or fewer employees with an average annual compensation of $25,000 and less, or less, I should say. As you move from 10 employees up to 25 employees, or as your average compensation moves from $25,000 to $50,000, then you start to phase the credit out. So it's not uncommon in tax legislation to use phase-outs. This credit uses two at the same time, and so the calculation gets a little cumbersome, and so we didn't want to put it up here and bog everybody down. That credit is a 35% credit for 2010, 11, 12, and 13. And then it's a 50% credit for 2 years after that. Now, some people say, well, that would be 2014 and 2015, and logic would tell you you're right. This is tax law, so you don't necessarily have to apply logic. You may elect not to use the credit in 2014 or 15, and my understanding is it would then still be eligible for 2 years after that if you wanted to use it then. I've had questions about a couple things on this. One of them is, do you have to have not provided health insurance before and start providing it now? Is that the way you qualify for this credit? And the answer is no. There are state credits that work that way, but at the federal credit, if you're a small employer right now, you currently provide health insurance, assuming you meet the primary requirement is that the employer contributes at least 50% of the total premium cost, or 50% of this benchmark, which benchmark occurs at a state level. As long as you do that, then you would still be eligible to claim the credit now. After you've claimed the credit, though, after 2014 and you've claimed the credit for 2 years, the credit goes away. And so it's an incentive to, one, incentivize employers that are not currently providing health insurance to provide it. It's also a subsidy for employers who currently are, but it will go away. It's not a permanent credit. It's also eligible for nonprofit organizations. We've had some questions about that. The percentages are a little less. It's a 25% credit for these first 4 years and a 35% credit for the 2 years after that. Not-for-profit organizations, or tax-exempt is what we probably ought to refer to them as instead. Tax-exempt organizations can utilize the credit to offset the actual withholding that they've withheld from employees or they can use it to offset the Medicare tax that they've either withheld from employees or that they've been required to pay for themselves. So that credit is there, whereas for our for-profit organizations, it's an income tax credit. You're not eligible to offset the withholding or the Medicare withholding or the employer's Medicare piece. It's just an income tax credit, subject to some rules on that side too. 2011, is that Terry? You want to kind of take us through that year?
Starting in 2011, there's going to be some additional kinds of reforms. One that you'll need to be aware of for your employees is what's called the CLASS Act. This is a new program for long-term care coverage. It's a little different in that most of the time as an employer, when you offer employees benefits, you say, okay, here are the benefit packages that I have available, and you can select the ones that you're interested in. This is different because your employees have to affirmatively opt out and say, no, I don't want to participate in the long-term care coverage. And probably those employees who are like 25 years old and in perfect health will say, not interested, I'm never going to be in a nursing home. So you will need to be prepared to help your employees make their selection in that instance. There's a new reporting requirement in 2011, which is for the W-2s that you're going to supply in January of 2012, and that is that as an employer, your W-2 form has to include the value of the health insurance provided to the employee. At this point, it won't be considered taxable income, but you do have to report that on the W-2. And I've had some employers say, well, is that going to be just the portion that the employer pays, or does it include the amount that the employee contributes? And Clinton's probably better prepared than I am to answer that. Do you know off the top of your head, Clinton?
So I don't know off the top of my head. My reaction is probably it's the amount that the employer contributes on the employee's behalf. And I was having a conversation the other day with one of the partners there in our office that works in the banking industry, and we were talking about healthcare reform and this financial reform and how the government's requiring a lot more reporting and a lot more. They're getting down into some real specifics, which we'll get into on the next page, but. They're collecting the information for a reason, and that's the cynic in me saying that. But you know, I think one reason is it starts to make it a habit for those companies that are offering some type of Cadillac plan to their employees that in 2018 is going to be subject to a tax. It gets them in the habit now of reporting it. My guess also is though it is being collected for a reason, trying to be quantified in terms of how much our employers spending on this?
It is actually the full premium. So if you're a fully insured plan, it's your medical premium. Vision and dental are excluded as a standalone plan. So it's your full premium, both employer and employee contribution if you're a fully insured plan. At this juncture, based on my new favorite phrase, what we know today, the self-funded plans, it's expected to be the COBRA equivalent premium that you'll use for reporting purposes, but we're waiting on confirmation and clarification from the regulators of that perspective. So we've got a little bit of time before those will come into play, and hopefully we'll receive that clarification before you have to start issuing those W-2s.